6:33 is your time, and this is Morning Barbados on a wet Wednesday morning. It's a wonderful day, nonetheless, still full of potential, so don't be afraid to grab a hold of it and make something happen. It's time to talk with our doctor on the line. Good morning, Dr. Lord.
Good morning, Cassandra. How are you?
I'm good. And yourself?
Excellent.
All the pleasantries. You guys, Katrina has a big question for you, so I'm going to let her start with her question.
Well, you know, Doctor, I always look forward to using you to pick your brain about any little things that any of my friends or relatives may have asked about. I'm curious this morning about nerve damage. I had a relative that had a fairly bad accident at work, and there's still some numbness. There's still, you know, having to sleep on those long pillows, physiotherapy. In terms of pain management, how does one deal with nerve damage over a period of time such that it does not impact on productivity? Because he's still quite young.
Yes, well, nerve damage and morning Barbados. Nerve damage, nerves take a long time to regenerate, to replace itself, to get back to its normal function. In the meantime, the physical therapy, pain therapy, which is different modalities of pain management, anti-inflammatories, and then there are certain nerve stimulating tablets that can be used to treat the problems, to make the person as comfortable as possible. Also occupational therapy, where they can use various devices to assist them in using their hands if it is the upper limb that you're talking about. But because nerve regeneration takes a long time, it does take a long time before the person regains full mobility and activity in that particular limb.
But it is possible that the chronic pain and discomfort will eventually subside. But it's not that you can take a nerve and put it on one side and let it rest.
Correct.
It kind of continues.
Yeah, it will take some time, but it can return to normal function.
Pleased to hear that. All is well with the world now. Doc?
Yes.
Cassandra, questions, comments from you?
Well, that's what we're all about, making sure that everybody's happy. And the numbers are on screen. You can give us a call if you have questions for our doctor, 228-5562 or 228-5563. I believe already we have Elvis waiting. Good morning.
Hi, good morning.
Hi,
Elvis.
Go ahead.
Okay,
with your question.
What you call these things, like we have like veins that burst on the skin?
Okay.
Veins that burst under the skin, those are bruises that can occur due to trauma. If there's any collision or damage to the particular limb, or sometimes they become very fragile and then they leak some blood. And these, what people call bruised blood, we call them hematomas, are easily nothing to worry about really. You put ice on them, and within a couple of days or weeks they do heal, clear up by themselves. If he's talking about varicose veins, then this is something obviously different, where specific therapy, medication, stockings, injections can be used to treat that problem.
Okay.
Look, I want to talk about Superman, or maybe even Superwoman syndrome. And let me give you a little background, because remember we were talking about Serena and how we thought she was going to be out of tennis for about at least a year.
Yeah, she's back now.
She started back playing. But before we get into that, let's welcome our next caller. Good morning, Joanne.
Jolan.
Good morning. Sorry.
I would like to ask, if you're small and you have asthma, when you grow up, you will still have it, or you could grow out of it?
Yeah, that is a common thing. Very good question about growing out of asthma. What I usually say is that you get less frequent attacks, or you manage the asthma better, and therefore you're able to cope with it, or you become less sensitive to the various allergens. If it is extrinsic asthma, that is if dust and smoke and certain smells cause it to come on, then as you get older you may be able to deal with it. There's also adult onset asthma, which is slightly different, but many people who have asthma in the youth tend not to have as frequent attacks. There are a lot of medications that are available now to help to prevent the attacks, and after a while you find that the requirement for the medication may be a lot reduced.
All right, so we say good morning to Andrea now. Good morning.
Hi, good morning.
How are you?
Good morning.
I wanted to ask the doctor about the treatment for spur on the bone in the heel, and if cortisone or steroid shots are advised, or surgery would be a good alternative.
Good question, Andrea. Spurs are just outgrowths of the bones, usually seen in the legs, in the feet. There's a bone called the calcaneus, which is to the back of the feet, and it can be seen by the heel or under that area. The treatment is trying to treat the cause. If it's a biomechanical problem, the position of how your feet are, then orthotics, which are inserts into the shoes, may help. Of course, painkillers can be used, and then, as you mentioned, the injection of a steroid, corticosteroid, into the area. That relieves the pain but doesn't treat the spur, so it can recur. So we need to look at the cause to try to treat the problem. And yes, steroids can be used. Surgery is not frequently used in this situation because, you know, they may damage nerves, as we mentioned, Katrina, earlier. It could damage nerves and other blood vessels there, and then you get another type of pain. So we tend to use the injection if other methods don't work.
All right, yeah. So the point I was trying to make with the Serena story is, what does this do for you and other doctors when you say to someone, you know what, you should stay away for this period of time, and then they say, well, what about her? You know, she jumped right back into it.
She didn't really jump back into it. She went through her period of therapy. She had to be on medication for a prolonged period of time. Maybe she's still on medication to thin that blood because the possibility of clots occurring and recurring. She still has to do long haul flights and so on. She would use heparin or Clexane, which is an injection. We give it under the skin before she travels, and every so many hours to prevent this from recurring, and the stockings. Yeah, but when they do come back, we're really happy. What we're saying is that you don't need to rest. You know, you need to get active at the correct time once the bleeding times are normal, and we also need to monitor those bleeding times to prevent the clots from recurring. By doing blood tests every 2 weeks, we can manage the condition.
Okay, Dr. Lara, we're going to take a call from Barbara. I want you to think about this, though. Recently, we had a caller who asked about eating ice and whether it was related to anything. And I heard again recently that there's something, if you eat ice constantly, it could mean that there's something wrong with your blood or something. I can't remember exactly what the person said, but maybe you can let me know. Good morning, Barbara.
Hello, good morning.
Morning.
Go ahead with your question.
Yeah, my daughter has a thing growing on her wrist, like a lump.
Yes.
And it has hurt she all the time. I recognized this thing about a year ago. But I would like to know what it really is.
How old is your daughter?
She's 18.
Yes. It is called a ganglion, G-A-N-G-L-I-O-N, a ganglion. It is a cyst, and it is usually a soft, round cyst, which is a round lesion with fluid in it. The reason it may be causing pain is because it may be near to a nerve or blood vessel, and that is an indication for it to be removed. As I mentioned on this program many times ago, the textbooks, and if you check the internet, it would say hit it hard with the Bible, and it would disappear, and might reappear. That is true. But if it is causing pain or discomfort,
Don't hit it.
you might need to have it surgically removed, so you can see a hand surgeon or orthopedic surgeon or general surgeon who can remove this cyst. A simple operation. And it really is because, when you ask about her age, is because of use of her hands. She probably uses her hands quite a lot, and the sliding of the various tendons and ligaments in there may be responsible for why this ganglion, why that appeared.
I would ask about the significance of a Bible versus a dictionary or another book, but maybe we'll wait for the commercial break. We do have Charmaine holding on the line. Good morning, Charmaine. Welcome to the program. What's your question?
Good morning.
Morning.
My question is in reference to what is referred to as leg cramp. You know, like when the muscle locks off and it's this intense pain and you're like shaking your leg trying to get it to unlock. What basically contributes to that?
A number of things can cause that, leg cramps. It could be lack of supply oxygen going down there. It can be spasm from the muscles where the muscles tighten up, as you quite aptly described, or it could be an electrolyte or fluid disturbance where you become dehydrated a lot. If you're sitting with your legs crossed, it is possible that what may be happening is that you may be putting pressure on a particular nerve that goes down into the leg and causing a cramp. So that maybe could cause it to be uncomfortable. If you're dehydrated, if you're in a air-conditioned environment or working outside, sweating a lot, then the important thing is to keep your fluids in. One other possible cause could be footwear. Wearing high-heel shoes or tall shoes sometimes can cause leg cramps. But you should see the doctor and see which one it is, and so that the correct advice can be given to solve your problem.
Okay.
Let's say good morning now to Tricia.
Good morning.
Good morning.
Morning, Tracy.
I'm calling to find out something. I have a daughter that at a year, and she does wheeze when she has a cold, but she doesn't have asthma. Another thing too, I have short of breath, and I wanted to know what can I do to help stop me from being so short of breath at times. Yes, I'm big, yes, so I realize that.
She may be having hyperreactive or overactive airway disease, which is a precursor to asthma, or which is asthma. Whenever she gets a cold, the airways, as you said, she's a daughter, she's probably young, your airways are very narrow. So when you get a cold, when she gets a cold, the airways become very more constricted, and therefore air cannot get into the blood vessel, into the lungs, and that causes the wheeze. What to prevent it? There is the inhalers which are available, taken when this happens to open up or dilate the airways, or oral medication, or there are the preventative inhalers that can be used, familiarly called the Brown inhalers, the steroid inhalers that can be used on a regular basis to prevent her from having this reaction to whatever, the cold, the dust, the smoke, the teddy bear, the curtains, whatever.
She has another question?
Prevention of her own shortness of breath.
Yeah, similarly, she would need to be, she's obviously, I would think she's asthmatic, and she needs to be on the asthma inhalers on a regular basis, twice a day, twice a day, of the preventative inhalers to prevent this
shortness of breath.
Shortness of breath, yeah. And if she's getting it after physical activity, then she can use the reliever inhalers half an hour or 20 minutes before physical activity, before she exercises, before she walks, before she jogs, swims, and so on, and that would also prevent that.
All right, we're going to continue shortly with our doctor on the line. We're talking with Dr. Adrian Lord, and your calls are indeed welcome right after the break.